Hello everyone, welcome to my YouTube channel. My name is Rashida and today we're going to be talking about bullying, lateral violence, which is bullying by your coworker in nursing, which is something that sadly many nurses, especially those from minoritized groups, can relate to. When you're in nursing school, you hear them say things like, oh, nurses eat their young, and they kind of normalize it in a way. And for me, my worst experience of lateral violence, which I guess it wasn't lateral yet, was when I was in nursing school and I did my med-surg clinical. My preceptor was not nice. The rated G way of saying it was that she wasn't nice. And I felt like I couldn't say anything, but in retrospect, I wish that I did speak up. It was kind of annoying because her coworkers, even the patients, knew that she wasn't a nice person, but she just was still allowed to walk around and be a nurse and lead a group of students and essentially try to haze them. But also, like any other abusive relationship, there was cycles. Like, she would do things and say things, but then she'll give you an A on an assignment, or she'll make you do something and then praise you for it, right? So it wasn't all bad. I'm not gonna sit here and say that I would go to clinical every day and she would be mean to me all the time, because that wasn't true. And also, I'm more on top of my work than I think maybe she expected. So she did give me a lot of praise, but she would do weird things like, so in med-surg, you know those patients can have like 20 meds. So I had a patient, I had to give him 14 medications. And she wanted you to know the name of the medication, both the brand name and the generic name. And then she also wanted you to know what the medication was used for, even off-brand or off-label uses. And I forget how many uses she wanted to know. It was like 2 or 3. And then she also wanted you to know what that patient's gonna get it for, because she wanted you to come to the hospital the day before to take notes on the patients that you were gonna be assigned, which sometimes the assignment changed, but whatever. And then also side effects of the medication. So I'm sitting there telling her for each and every medication, just listening off, and she would do it in front of the patient too. And if you couldn't do it, then she wouldn't let you give the meds, and then that would make you look super incompetent in front of the patient that you're gonna have to be helping to care for the next 12 hours. But so I list off all the things that she asked me to list off, and then she goes, great job, but it wasn't quick enough. Like, girl, I had to memorize all of this. And then after a while, I think she started letting us use the computer a little bit to talk about the medications, but definitely not in the beginning. Like, she did not let us use the computer. And then after she left, even the patient was like, what's her problem? I'm like, bro, I don't know. She was really weird, and I'm glad that I survived that, but she would have some people crying in the bathroom, and I just knew it must have been a nightmare to work with her. But then outside of that, she would be so nice. Like, she was open to being a recommendation if you wanted a job. She was open to helping you get a job in the unit, but it's like, girl, why would I get a job with you? And then we did so much work because the unit was short, and this is pre-pandemic. This is like 2018. And it's like, the reason that the unit is short is because you let these nurses run rogue and talk to anyone any type of way. That was my experience with lateral violence that was the most significant. I've dealt with, nurses having attitudes, and sometimes I can't tell if they're an auntie or if they are just mean. Like, if, Haitian, Filipino, Caribbean, African, you know what I'm talking about when I say auntie. Like, some people just are aunties, and not saying that it's right, but at least I know that and I know how to deal with it. But sometimes it's like, are you just an auntie, or do you not like me, or do you hate this job? Because you can quit. Like, if you hate nursing enough to abuse your coworkers, just quit. And my advice to people who aren't mean is, if you see someone experiencing lateral violence, or your coworker you could tell is getting frustrated, or they're not seen or heard at work, speak up. I'm always gonna speak up, and that might not make me the most popular person sometimes, But I mean, most of the time, honestly, most of my coworkers love me, like everywhere I work. But in few cases where I did have to speak up, whether it was for myself or for someone else, that person's a priority. Like they come here to work. Actually, really, the patient's a priority. But if someone doesn't feel comfortable enough to speak, they don't feel comfortable enough to ask questions, they don't feel comfortable enough to ask for help, then the patient's lives are at risk. And that's not even to be dramatic, but it just goes to show how harmful lateral violence can be in the hospital. So we really need to stop doing that because it's not cute. And also, I see you online talking about the nurses who have the 40-inch bust down and who wear makeup to work and who might have a BBL. Like, that has nothing to do with nursing. And it's unfair that we sometimes have to deal with abuse from our coworkers. We often have to deal with abuse from patients. And then now online, we went from being, oh, nurses are superheroes to nurses shouldn't have wigs and shouldn't have makeup and shouldn't have their body done. And I don't look like this at work. I'm gonna keep it 100. And I don't have my body done because I have a great trainer and Jesus blessed me because the body is tea. But I'm also not gonna judge someone else on how well they can do something based on the way that they look. Like, that is weird, guys. Let's stop doing that. Like, we already have to deal with enough. So I'm gonna end this video here, but I am gonna do a part 2 on what you can do if you have to deal with lateral violence, steps that you can take from my experiences or from things that I've seen other people do that have worked. But stay safe out there. I know it's not Nurses Week anymore, but on this channel, it's always Nurses Week. So shout out to my nurses, shout out to my healthcare workers, shout out to my future nurses. And don't forget to like, guys, subscribe, and share. Be nice to your coworkers, and I'll see you next time.